Introduction to vitamins. Vitamins. Vitamins are organic compounds that are essential in very small amounts for supporting normal physiologic function. We need vitamins in our diet because our bodies can't synthesize them quickly enough to meet our daily needs. Vitamins have three characteristics. They are natural components of foods, usually present in very small amounts. They are essential for normal physiologic function, e.g., growth, reproduction, etc. When absent from the diet, they will cause a specific deficiency. Vitamins are generally categorized into the following types: water-soluble, fat-soluble. Water-soluble vitamins. Vitamin B1, thiamine. Deficiency symptoms include burning feet, weakness in extremities, rapid heart rate, swelling, anorexia, nausea, fatigue, and gastrointestinal problems. Toxicity, none known. Sources: sunflower seeds, asparagus, lettuce, mushrooms, black beans, navy beans, lentils, spinach, peas, pinto beans, lima beans, eggplant, Brussels sprouts, tomatoes, tuna, whole wheat, soybeans. Vitamin B2, riboflavin. Deficiency symptoms include cracks, fissures and sores at corner of mouth and lips, dermatitis, conjunctivitis, photophobia, glossitis of tongue, anxiety, loss of appetite, and fatigue. Toxicity: excess riboflavin may increase the risk of DNA strand breaks in the presence of chromium. High-dose riboflavin therapy will intensify urine color to a bright yellow, flavonuria, but this is harmless. Sources: almonds, soybeans/tempeh, mushrooms, spinach, whole wheat, yogurt, mackerel, eggs, liver. Vitamin B3, niacin. Deficiency symptoms include dermatitis, dementia, and stomatitis. Toxicity: niacin from foods is not known to cause adverse effects. Supplemental nicotinic acid may cause flushing of skin, itching, impaired glucose tolerance, and gastrointestinal upset. Intake of 750 milligrams per day for less than 3 months can cause liver cell damage. High-dose nicotinamide can cause nausea and liver toxicity. Sources: mushrooms, asparagus, peanuts, brown rice, corn, green leafy vegetables, sweet potato, potato, lentil, barley, carrots, almonds, celery, turnips, peaches, chicken meat, tuna, salmon. Vitamin B5, pantothenic acid. Deficiency, very unlikely. Only in severe malnutrition may one notice tingling of feet. Toxicity, nausea, heartburn and diarrhea may be noticed with high-dose supplements. Sources: broccoli, lentils, split peas, avocado, whole wheat, mushrooms, sweet potato, sunflower seeds, cauliflower, green leafy vegetables, eggs, squash, strawberries, liver. Vitamin B6, pyridoxine. Deficiency symptoms include gallosis, glossitis, stomatitis, dermatitis, all similar to vitamin B2 deficiency. Nervous system disorders, sleeplessness, confusion, nervousness, depression, irritability, interference with nerves that supply muscles and difficulties in movement of these muscles, and anemia. Prenatal deprivation results in mental retardation and blood disorders for the newborn. Toxicity: high doses of supplemental vitamin B6 may result in painful neurological symptoms. Sources: whole wheat, brown rice, green leafy vegetables, sunflower seeds, potato, garbanzo beans, banana, trout, spinach, tomatoes, avocado, walnuts, peanut butter, tuna, salmon, lima beans, bell peppers, chicken meat. Vitamin B7, biotin. Deficiency, very rare in humans. Keep in mind that consuming raw egg whites over a long period of time can cause biotin deficiency. Egg whites contain the protein avidin, which binds to biotin and prevents its absorption. Toxicity, not known to be toxic. Sources: green leafy vegetables, most nuts, whole grain breads, avocado, raspberries, cauliflower, carrots, papaya, banana, salmon, eggs. Vitamin B9, folic acid. Folate is the naturally occurring form found in foods. Folic acid is the synthetic form used in commercially available supplements and fortified foods. Inadequate folate status is associated with neural tube defects and some cancers. Deficiency: one may notice anemia, macrocytic/megaloblastic, sprue, leukopenia, thrombocytopenia, weakness, weight loss, cracking and redness of tongue and mouth, and diarrhea. In pregnancy, there is a risk of low birth weight and preterm delivery. Toxicity: none from food. Keep in mind that vitamin B12 and folic acid deficiency can both result in megaloblastic anemia. Large doses of folic acid given to an individual with an undiagnosed vitamin B12 deficiency could correct megaloblastic anemia without correcting the underlying vitamin B12 deficiency. Sources: green leafy vegetables, asparagus, broccoli, Brussels sprouts, citrus fruits, black-eyed peas, spinach, Great Northern beans, whole grains, baked beans, green peas, avocado, peanuts, lettuce, tomato juice, banana, papaya, organ meats, vitamin B12, cobalamin. Vitamin B12 must combine with intrinsic factor before it's absorbed into the bloodstream. We can store a year's worth of this vitamin, but it should still be consumed regularly. B12 is a product of bacterial fermentation, which is why it's not present in higher-order plant foods. Deficiency symptoms include pernicious anemia, neurological problems and sprue. Toxicity, none known from supplements or food. Only a small amount is absorbed via the oral route. Thus the potential for toxicity is low. Sources: fortified cereals, liver, trout, salmon, tuna, haddock, egg, vitamin C, ascorbic acid. Deficiency symptoms include bruising, gum infections, lethargy, dental cavities, tissue swelling, dry hair and skin, bleeding gums, dry eyes, hair loss, joint pain, pitting edema, anemia, delayed wound healing, and bone fragility. Long-term deficiency results in scurvy. Toxicity, possible problems with very large vitamin C doses including kidney stones. Rebound scurvy. Increased oxidative stress. Excess iron absorption. Vitamin B12 deficiency. And erosion of dental enamel. Up to 10 grams/day is safe based on most data. 2 grams or more per day can cause diarrhea. Sources: guava, bell pepper, kiwi, orange, grapefruit, strawberries, Brussels sprouts, cantaloupe, papaya, broccoli, sweet potato, pineapple, cauliflower, kale, lemon juice, parsley. Fat-soluble vitamins. Vitamin A, retinoids. Carotenoids that can be converted by the body into retinol are referred to as provitamin A carotenoids. Deficiency: one may notice difficulty seeing in dim light and rough/dry skin. Toxicity: hypervitaminosis A is caused by consuming excessive amounts of preformed vitamin A, not the plant carotenoids. Preformed vitamin A is rapidly absorbed and slowly cleared from the body. Nausea, headache, fatigue, loss of appetite, dizziness, and dry skin can result. Excess intake while pregnant can cause birth defects. Sources: carrots, sweet potato, pumpkin, green leafy vegetables, squash, cantaloupe, bell pepper, Chinese cabbage, beef, eggs, peaches, vitamin D, calciferol. 125. Dihydroxyvitamin D. Cholecalciferol equals vitamin D3 equals animal version. Ergocalciferol equals vitamin D2 equals plant version. Deficiency. In children, a vitamin D deficiency can result in rickets, deformed bones, retarded growth, and soft teeth. In adults, a vitamin D deficiency can result in osteomalacia, softened bones, spontaneous fractures, and tooth decay. Those at risk for deficiency include infants, elderly, dark-skinned individuals, those with minimal sun exposure, fat malabsorption syndromes, inflammatory bowel diseases, kidney failure, and seizure disorders. Toxicity. Hypervitaminosis D is not a result of sun exposure but from chronic supplementation. Excessive supplement use will elevate blood calcium levels and cause loss of appetite, nausea, vomiting, excessive thirst, excessive urination, itching, muscle weakness, joint pain and disorientation. Calcification of soft tissues can also occur. Sources: sunlight, fortified foods, mushrooms, salmon, mackerel, sardines, tuna, eggs. Vitamin E, tocopherol. Deficiency, only noticed in those with severe malnutrition. However, suboptimal intake of vitamin E is relatively common. Toxicity. Minimal side effects have been noted in adults taking supplements in doses less than 2,000 milligrams per day. There is a potential for impaired blood clotting. Infants are more vulnerable. Sources: green leafy vegetables, almonds, sunflower seeds, olives, blueberries, most nuts, most seeds, tomatoes, avocado. Vitamin K. Deficiency, tendency to bleed or hemorrhage and anemia. Toxicity, may interfere with glutathione. No known toxicity with high doses. Sources: broccoli, green leafy vegetables, parsley, watercress, asparagus, Brussels sprouts, green beans, green peas, carrots. Introduction to vitamins.